സ്റ്റൊമക് ക്യാൻസർ ഇപ്പോൾ സാധാരണ നമുക്ക് കാണുന്ന ഒരു ക്യാൻസറാണ് സ്റ്റൊമക് ക്യാൻസർ. ഇത് 60 വയസ്സോടടുത്തുള്ള ആ ജനറേഷനിൽ കാണുന്നുണ്ട്. കൂടാതെ ഇപ്പോൾ യങ്ങർ ജനറേഷനിലും ഇത് കൂടുതലായി കണ്ടെത്തുന്നുണ്ട്. ഈ വിഷയമാണ് ഇന്ന് മെഡിട്രാക്ക് ചർച്ച ചെയ്യുന്നത്. പ്രിയ പ്രേക്ഷകർക്ക് കാസർഗോഡ് വിഷൻ്റെ മെഡിട്രാക്കിലേക്ക് സ്വാഗതം. ഈ വിഷയത്തെക്കുറിച്ച് കാസർഗോഡ് വിഷൻ്റെ പ്രേക്ഷകരോട് സംസാരിക്കുന്നത് മാംഗ്ലൂർ AJ ഹോസ്പിറ്റലിലെ സർജിക്കൽ ഓങ്കോളജിസ്റ്റ് ഡോക്ടർ അജയകുമാറാണ്. സർ, വെൽക്കം.
നമസ്തേ.
ഞാൻ ഇൻട്രോയിൽ തന്നെ പറഞ്ഞത്, അതായത് നമ്മൾ ഇന്ന് ഡിസ്കസ് ചെയ്യുന്ന വിഷയം എന്ന് പറയുന്നത് സ്റ്റൊമക് ക്യാൻസറിനെ കുറിച്ചാണ്. റീസെൻ്റ് ആയിട്ട് നമ്മുടെ സൊസൈറ്റിയിൽ പ്രത്യേകിച്ച് പുരുഷന്മാരിൽ വയറിൻ്റെ ക്യാൻസർ കൂടി വരുന്നുണ്ട്. പ്രത്യേക ഒരു 60 ഏജിലൊക്കെ ഉള്ളവർക്ക് അത് കൂടുതലായിട്ട് കാണുന്നുണ്ട്. പക്ഷേ ഇപ്പോൾ അത് യങ്ങർ ജനറേഷനിലും പിന്നെ OPD സാറിന് ശ്രദ്ധിക്കാൻ പറ്റുന്നു അങ്ങനെയുള്ള കേസസും കണ്ടുവരുന്നുണ്ട്. ക്യാൻസർ എന്ന് പറയുമ്പോൾ തന്നെ സൊസൈറ്റിയിൽ ഏത് തരം, വെതർ ഇറ്റ് സ്റ്റേജ് 1 2 3 4 ക്യാൻസർ എന്ന് കേൾക്കുമ്പോൾ തന്നെ ചിലവർക്ക് ചില പേടിയൊക്കെ നമ്മുടെ സൊസൈറ്റിക്ക് ഉണ്ടാകുന്നുണ്ട്. വയറിലെ ക്യാൻസർ, സ്റ്റൊമക്ക് ക്യാൻസർ എന്ന് പറഞ്ഞാൽ നമ്മുടെ പ്രേക്ഷകർക്ക് വളരെ സിമ്പിളായി ലളിതമായിട്ട് എങ്ങനെ പറഞ്ഞു കൊടുക്കാം?
ഓക്കെ. സ്റ്റൊമക് ക്യാൻസർ, to define cancer is nothing but uncontrolled growth of cells in the body. That is cancer.
Okay, sir.
Now coming to stomach cancer. Stomach cancer is the cancer which is affecting the stomach, which is a part of our digestive system.
Yes.
When we eat food has to pass through the mouth and then the food pipe. Then it has to enter into the stomach. There it is going to be there for some more time, wherein the grinding of the food occurs, right? That is a part of the digestive system called as stomach. So there is a inner lining of the stomach, right? That we call as a mucosa. So if any cells in that mucosa or the cells in the muscle layer of the stomach, if they grow uncontrollably, then it forms cancer. So in general we call that as a stomach cancer. So most commonly if you say, it is the inner lining of the stomach which leads to stomach cancer. So that we call it as adenocarcinoma. And sometimes there is a formation of tumor from the muscle layer of the stomach. That we call as leiomyoma or GIST, right? So these are the different types of the stomach cancer that we come across, but most commonly 90-95% is adenocarcinoma.
അങ്ങനെയാണെങ്കിൽ ഈ സ്റ്റൊമക്ക് ക്യാൻസർ അതിനൊരു തുടക്കം ഉണ്ടാവില്ല, ഒരു ബിഗിനിങ് ഉണ്ടാവില്ല, അതെങ്ങനെയായിരിക്കും?
So most commonly stomach cancer doesn't have any symptoms in the beginning. Okay.
That's a dangerous answer.
Yes. Yeah. It doesn't have any beginning. Because when you eat food will enter into stomach. So we don't feel any discomfort, right? We feel good that food has entered into stomach. Similarly, if a tumor is growing in the stomach, since the stomach can distend, well there is chances unnalla stomach. So cancer in the session ado stomach well died symptoms kuda varanilla. No symptoms in the stomach because stomach can distend. That's why most of the patients they come in the later stages. Fine.
നമുക്ക് സിംറ്റംസിലേക്ക് വരുന്നതിന് മുന്നേ അങ്ങനെയാണെങ്കിൽ നമ്മൾ ഏതൊരു ഡിസീസും ഏതൊരു രോഗത്തിനും ചില റീസൺ ഉണ്ടാവുമല്ലോ സർ. ക്യാൻസറിന് നമുക്ക് ഒരു റീസൺ എന്താണെന്നില്ല, അങ്ങനെ ഹൗ ടു എക്സ്പ്ലെയിൻ ആയിട്ട് തോന്നും. എനിക്കോ ഇതിന് അങ്ങനെയാണെങ്കിൽ സ്റ്റൊമക്ക് ക്യാൻസർ വരാനുള്ള ഒരു കാരണങ്ങൾ, ഫോർ എക്സാമ്പിൾ നമ്മുടെ ഡെയിലി ലൈഫിൻ്റെ ഫുഡ് ഹാബിറ്റോ, നമുക്ക് ട്രഡീഷണൽ ഫുഡ് ഇതൊക്കെ കഴിക്കുന്നത്, ഇതൊക്കെ ഈ സ്റ്റൊമക്ക് സാർ ഓൾറെഡി സാർ എക്സ്പ്ലെയിൻ ചെയ്ത് കഴിഞ്ഞു എന്താണ് സ്റ്റൊമക്ക് ക്യാൻസർ. ഇത് സ്റ്റൊമക്കുമായി റിലേറ്റഡ് ആയിട്ടുള്ള ഡൈജസ്റ്റീവ് സിസ്റ്റത്തിൽ ബാധിക്കുന്ന ഒരു കാര്യം. അങ്ങനെയാണെങ്കിൽ നമ്മുടെ ട്രഡീഷണൽ ഫുഡോ നമ്മുടെ ലൈഫ് സ്റ്റൈലോ അല്ലെങ്കിൽ നമ്മുടെ ഫുഡ് ഹാബിറ്റോ ഇതിന് ഏതെങ്കിലും തരത്തിൽ എഫക്ട് ചെയ്യും?
ഓക്കെ. സോ മോസ്റ്റ് കോമൺലി ನಮ್ಮ ಈ ಪ್ರದೇಶದಲ್ಲಿ the stomach infection ഉണ്ട്. Caused by H. pylori infection. H. pylori infection is the most common infection that is present in the stomach, which is a most common causative factor for stomach cancer. And the patient with this infection will have acidity, bloating sensation, not a good digestion, what we say. So those patients will have the H. pylori infection. That is the most common cause. Next is the type of food that we eat, right?
What type of stuff?
The type of food, like you can say salted food, processed food, preserved food. So there is something called natural food, banana, that we eat directly plucking from the trees,
directly,
right? But if similarly we have tender coconut, we drink tender coconut water, and then we eat the coconut inside. But if we process that banana or the tender coconut to increase the shelf life, sometimes from Kerala we have to export it to other part of the country or other countries. Similarly, we get same food from other part of the country, which are made to have better shelf life, so that we can consume it after 1 week.
Okay.
We know that banana after 2 days it gets decayed, right? Or it can get worsen. We can't have food.
Yeah.
But the banana that we get from, let's say from Uttar Pradesh, so they have plugged it sometimes back, maybe 1 week or 10 days back, but they have preserved it. So that is what is a preserved or processed food.
Okay.
So if we increase that processed or preserved food, there is a higher chance of getting a stomach cancer.
Okay.
Other thing is salted food. So if we have, we consume fish daily, 2 or 3 times a day.
Okay.
But if you get the fish which is preserved by putting more amount of salt and ice, so consuming that salted food can cause stomach cancer. Sometimes also smoked food.
Yeah. Yes.
So if you increasingly burn the food to a longer extent by consuming that smoked food, can lead to stomach cancer particularly.
Okay.
Right. So even smoking, madhyam, alcohol. Yes. So even that can lead to stomach cancer. And rarely there is chances of genetic predisposition, hereditary we say, no?
Okay.
So even that can be caused. That is, but that is only 10%. 8 to 10%.
Okay.
The remaining 90% is because of these changes in our food habits or less amount of exercise, madhyam and smoking, all those things.
Okay. Sir, നമ്മുടെ ഈ ടോക്കിന്റെ ബിഗിനിങ്ങിൽ സാർ പറഞ്ഞു സ്റ്റൊമക് ക്യാൻസറിന് അങ്ങനെ സിംറ്റംസ് ഒന്നും ഇനീഷ്യൽ സ്റ്റേജിൽ അല്ലെങ്കിൽ ആദ്യം ഒന്നും കാണാൻ പറ്റില്ല എന്ന് പറഞ്ഞു. എപ്പോഴാണ് സിംറ്റംസ് കാണുക?
Okay. Symptoms. Even in the stage 1 disease, even before stomach cancer starts manifesting in the stomach, right? Okay. Before the stomach cancer, there is a chances that patient might be having acidity, indigestion, bloating sensation, regurgitation, that vomiter like holy day we say in Kannada, that it can come. So these are the few initial symptoms. Then later on patient can start experiencing pain. Pain is the one when patient comes to the hospital to the doctor. But what I say is, even if the patient is not having pain, if he starts having any symptom like acidity, some lump in the stomach, so then the patient should come early. If patient has pain, it means what? The cancer has progressed in stage. So it means the patient has gone to stage 2 or 3, right? So then the treatment will be a bit complex. The chances of getting cured will be on lesser side. So that pain can be a major symptom. Then patient might have what we call as loss of appetite, decreased food intake, right? Or sometimes the patient will have little food, then he will have completeness of hungerness. Hungerness will go away. So that is there. That is called as satiety, early satiety. Then after that patient might have the loss of weight. That also is indicative of the later stages, higher stages. So loss of weight without any exercise or intentional weight loss is not there, but patient is losing weight. So those things also are symptoms of stomach cancer.
See sir, ഇപ്പോൾ സാറ് പറഞ്ഞു കഴിഞ്ഞു, കാരണം ചില സിംറ്റംസ് ഇതാണ്, ദീസ് ആർ ദ സിംറ്റംസ്. ഈ സിംറ്റംസ് ചിലർക്ക് അറിയാൻ പറ്റും, നേരത്തെ അറിയാൻ പറ്റും, അല്ലെങ്കിൽ കണ്ടെത്താൻ പറ്റും. ഈവൻ ദോ അത് കണ്ടെത്തിയാൽ പോലും ചിലപ്പോൾ അവർ ഡോക്ടറെ സമീപിക്കില്ല. ദാറ്റ് വിൽ ബി, ആ സിറ്റുവേഷൻ കൂടുതൽ കോംപ്ലിക്കേറ്റഡ് ആകും, അല്ലെങ്കിൽ അത് ലീഡ് ചെയ്യുന്നത് കൂടുതൽ കോംപ്ലിക്കേറ്റഡ് സിറ്റുവേഷനിലേക്കല്ലേ പോകുന്നത്. അങ്ങനെ ഒരു സിറ്റുവേഷൻ അങ്ങനെ ഒരു സിറ്റുവേഷനിൽ സാറുടെ ഒ പി ഡിയിലൊക്കെ പേഷ്യന്റ് വന്നു കഴിഞ്ഞാൽ വാട്ട് ഈസ് യുവർ സജഷൻ, വാട്ട് ഈസ് യുവർ അഡ്വൈസ്?
Okay, the most why patient they don't come even after seeing the symptoms, because patient they think that let us take some medications first, let us do some home medicines. So they take home medicines, the gas acidity will come down, they feel better. That is, we call it as normalization of the symptoms. Symptoms become normal. Then they keep on repeating the same things for longer period of time. There is a one reason why patient they don't come to hospital, right? Even if they have symptoms. Second reason is fear, bhayam. Most of the patients they feel some stomach cancer is there.
They already assessed and
they know that there is something major thing in their body. It can be cancer also, they know. But still they don't come because they have that fear of cancer. So what I tell is, don't fear for the cancer disease. So it is curable. It is not a end statement. Right?
ഓക്കെ സർ. സി നമ്മളിപ്പം സിംറ്റംസിനെ കുറിച്ച് ഡീറ്റെയിൽ ആയിട്ട് പറഞ്ഞു, എന്താണ് സിംറ്റംസും അത് എപ്പോഴാണ് ഡോക്ടറെ കണ്ടെത്തണമെന്നും പറഞ്ഞു. ഓക്കെ, നമ്മൾ സിംറ്റംസ് വന്നു, ഡോക്ടർ ഒ പി ഡിയിൽ സിംറ്റംസ് വന്നൊരു പേഷ്യൻറ്റ് വന്നു കഴിഞ്ഞാൽ നെക്സ്റ്റ് സ്റ്റേജ് ഇസ് നാച്ചുറലി ഡയഗ്നോസിസ്.
Yes.
Then what are the diagnoses?
Once patient comes to us with all the symptoms, we make some diagnosis in our mind, so that it can be just acidity, or it can be hernia, hiatal hernia in the stomach, or it can be some ulcer, or it can be cancer also at the end. So then we subject the patient to simple test called as endoscopy. Gastroscopy or endoscopy. So wherein we take endoscopy, put it in the mouth, through the mouth we take the food pipe into the stomach. We see how is the inner lining of the stomach. I said in the earlier stages that inner lining of the stomach is where the common cancer comes. So that we inspect whole of the stomach. Then if there is any ulcer, then we take biopsy from that ulcer. If we see ulcer which looks like a cancerous one, we take a biopsy. Then if there is any compression from outside because of the tumor in the muzzle of the stomach, then we do something called as EUS, endoscopic ultrasound, through endoscopy only, and we take a biopsy from there. And if nothing is there, most of the patients that we have, non-cancerous patient, so we do take some sample from the stomach, and we test it for H. pylori infection. Why the patient have the symptoms? Then we come to know that this patient is having H. pylori infection, so let us treat for this infection, because if we leave like that only, that H. pylori bacteria can lead to cancer in the future
later.
So these are the initial steps that we do. But once we come to know that this is ulcer, malignant cancer is proven, then we subject the patient to CT scan after endoscopy. From simple endoscopy we will come to all these things. After that we subject the patient to CT scan. So after CT scan we will subject her to PET CT scan if it is a proven case, to know the stage of the disease.
സി ഡോക്ടർ, നമ്മൾ സാധാരണ പൊതുവേ ഹെൽത്തിനെ കുറിച്ച് കോഷ്യസ് ഉള്ള ആളുകൾ നമ്മൾ എന്ത് ചെയ്യും, നമ്മൾ BP ഷുഗറൊക്കെ ചെക്ക് ചെയ്യാറുണ്ട്. ഓക്കെ, സോ അതുപോലെ ഇപ്പോൾ ഫോർ എക്സാമ്പിൾ എനിക്ക് മറ്റു സിംറ്റംസ് ഒന്നുമില്ല, എനിക്കൊരു എൻഡോസ്കോപ്പി വേണമെന്ന് എനിക്ക് ഡയറക്റ്റ് പോയിട്ട് ഒരു ഡോക്ടർ, അങ്ങനെ പറ്റുമോ? നമുക്ക് നമ്മുടെ വയറ് അല്ലെങ്കിൽ പരിശോധിക്കാൻ അല്ലെങ്കിൽ ഡയഗ്നോസ് ചെയ്യാൻ വേണ്ടിയിട്ട്. സി ആക്ച്വലി ഐ ഹാവ് നോ സിംറ്റംസ് ഇൻ ദർ. ഓക്കെ, എനിക്കോ നമ്മളിപ്പം BP ഉണ്ടോ എന്ന് ചെക്ക് ചെയ്യുന്നുണ്ടല്ലോ, നമ്മൾ ഷുഗർ ഉണ്ടോ എന്ന് ചെക്ക് ചെയ്യുന്നുണ്ടല്ലോ, അതുപോലെ വയറിനകത്ത് വേറെ എന്തെങ്കിലും അസ്വാഭാവികമായ കാര്യങ്ങളുണ്ടോ എന്നറിയാൻ ഒരു പെർട്ടിക്കുലർ ഏജ് ഉണ്ടോ? അത് അല്ലാതെ എനിക്ക് സ്വമേധയാ വന്നിട്ട് ഒരു ഡോക്ടറെ കണ്ടിട്ട് സാർ എൻ്റെ ഒരു എൻഡോസ്കോപ്പി ചെയ്യണമെന്ന് പറയാൻ പറ്റും?
Usually after 45 years we suggest everyone to undergo endoscopy.
What is the duration? Yearly?
3 yearly.
3 yearly.
3 yearly. Once. Like every 3 year or every 3rd year you are going to go and get endoscopy. And if you have symptoms, especially acidity, yes, and if you have taken, if you are a very stressful person, who keeps on having that regurgitation, indigestion, so those patients, or we have the type A personality individuals, which takes more amount of stress in their life. So these people have higher chances of getting H. pylori infection. Those people should have frequent endoscopy, especially every 3rd year. That is one thing. So for normal individual, after 55 years, they can do a apergioscopy. Every 5th year is recommended in the guidelines.
So basically endoscopy and CT scans are told. So why this PET CT came, sir? What is the role of PET CT?
PET CT basically here everywhere, if there is suspect of cancer, suspect means it is not proven still. Doctor also thinks and also patient also thinks that there is a chance of cancer, not yet proven. But still patient they go for PET CT. So what I say is PET CT is only for a patient who is a cancer patient, who is a diagnosed cancer patient after taking a biopsy. In those patients what we do is we subject the patient to PET CT only to know the stage of the disease.
That means diagnose it whether it is cancer or not. If it is proved, then only
we need PET CT. It is only to see what is the stage of the disease. Sometimes patient will come to us with a mola in the neck side, neck node. We do biopsy. Then it comes out to be cancer. But we don't know where the primary cancer is, from where the cancer has come to the neck,
Yeah, whether it is spread or not, that one.
from where it has come.
Okay, understood.
So for that also we do PET CT. Okay.
Okay.
So we want to know from where the tumor has come and spread to the neck.
Okay.
From here the tumor has come.
Okay.
മുള ഉണ്ട്
Yeah.
ഇവിടെ സൂചിയിൽ ചെയ്തിട്ട്
Biopsy.
ക്യാൻസർ ബയോപ്സി ചെയ്തിട്ട് ക്യാൻസർ എന്ന് പ്രൂവ്
Prove
ചെയ്യുന്നു.
ചെയ്താൽ.
But from where that is this tumor has come,
Okay.
from what is the primary, from stomach, lungs, we don't know.
Okay.
For that to know, we do PET CT. So this is second usage of PET CT.
Okay.
So first usage is to know the stage of the disease.
Okay.
Second usage is from where the tumor has come. If we don't know if we don't know the primary tumor, primary organ.
Okay.
Okay.
Okay. Okay. Fine, sir. Then അങ്ങനെയാണെങ്കിൽ ഇപ്പം നമ്മൾ ഡയഗ്നോസ് ചെയ്ത് കഴിഞ്ഞു, ഡയഗ്നോസ് ചെയ്തിട്ട് അത് ക്യാൻസർ ആണെന്ന് ഒരു പേഷ്യന്റ് ക്യാൻസർ ആണെന്ന് സ്ഥിരീകരിച്ചു കഴിഞ്ഞാൽ നാച്ചുറലി നെക്സ്റ്റ് വി ഗോസ് ടു ട്രീറ്റ്മെന്റ്. ഈ ഓപ്ഷൻസ് എന്തൊക്കെയാണ്, ട്രീറ്റ്മെന്റ് ഓപ്ഷൻസ് എന്തൊക്കെയായിരിക്കും?
ഓക്കെ, ഞാൻ സർജിക്കൽ ഓങ്കോളജിസ്റ്റ്.
Yeah.
I deal with surgery.
Yeah.
Okay, I treat the patient. I'm happy. I treat cancer patient because I can cure the patient.
Okay.
Because in solid organ tumors,
Okay.
surgery is the main role to cure the patient because we can remove the tumor
Yes.
and take it outside of the body. So by that we can cure the patient. So even stomach cancer also, for stage 1 disease,
Okay.
it is very rare to get, but yes, we can do surgery and we can cure the patient.
Okay.
For stage 2 tumors and stage 3 tumors, what we do is we go for chemotherapy first, followed by surgery,
Okay.
right?
Okay.
Then followed by chemotherapy.
Okay.
That is the treatment strategy or the guidelines that we use. For stage 4, it is advanced disease. We can still we can give treatment for the patients. And so these are the type of treatment that we give based on the stages of the patient.
ഓക്കെ സാർ, ഹിയർ ഇസ് ഇവിടെ ഒരു ഡൗട്ട് വരുന്നത്. ഇപ്പോൾ സാർ പറഞ്ഞല്ലോ സ്റ്റേജ് 1 ക്യൂറബിൾ, സ്റ്റേജ് 2 ഓക്കെ ക്യൂർ. സി ഇഫ് ഇറ്റ് ഇസ് സ്റ്റേജ് 4, എസ്പെഷ്യലി ഫോർ വ്യൂവേഴ്സ് സർ, ദേ ഹാവ് സം ഡൗട്ട്.
Yeah.
സ്റ്റേജ് 4 സംടൈംസ് ചില പറഞ്ഞോ അറിയാതെ ചില ഇറ്റ്സ് ആൻ എൻഡ് ഓഫ് ലൈഫ്. സ്റ്റേജ് 4 അങ്ങനെയാണെങ്കിൽ ഇപ്പോൾ സ്റ്റേജ് 4 സാർ ഇപ്പം സർജിക്കൽ ഓപ്ഷൻസ് പറഞ്ഞു. Why,
Yes.
sir? Why that?
Okay, stage 4 also I treat few patients,
Yeah.
right?
Yeah.
Few patients in the sense which are having, basically if you see stage 4 nothing but from stomach it has spread to other part of the body,
Yes.
other organs,
Yeah.
right?
Correct.
Like in the stomach, it is in the abdomen.
Okay.
Abdomen is covered by one layer called as peritoneum inside, and stomach is beside liver. Sometimes the stomach tumor or stomach cancer is spread only to the liver, right? Then it also becomes stage 4. Sometimes stomach cancer spread to only to the peritoneum, the inner layer.
Yes.
So then it is stage 4.
Okay.
If it is not spread to multiple organs,
Okay.
if it is spread to only to single organ, in such selected patients, what we do is we give chemotherapy first.
Yeah.
We see the response, and then I subject the patient to surgery,
Surgery.
wherein I remove the stomach.
Okay.
That are very spread, the lymph nodes that are spread, that I remove as a standard cancer gastrectomy surgery that I do for stomach. Along with that, I remove part of the liver which is affected,
Okay.
then part of the peritoneum that is affected.
Okay.
So these are all highly selected patients.
Okay.
So because of the advancement in the treatment, advancement in the chemotherapy, and advancement in the surgical technology that
Technology
we
also.
do
Yeah.
as a surgical cancer surgeon.
Even it is fourth stage.
Yeah.
Also. Yeah.
Surgical oncologists are the cancer surgeons. They know how to do a surgery in cancer patients.
Yeah. Correct.
So surgical oncologists are the doctors or the surgeons which are trained only in cancer treatment. We don't know any other surgeries
Okay.
except cancer surgeries.
Yes.
We don't know how to do appendix surgery. We don't know how to do gallbladder cholecystectomy surgery. We don't know how to do hernia surgery, right?
Okay.
But we know how to do a complex cancer surgeries.
Cancer surgery.
That too, how to take our patient to a curable state.
Correct.
So we are reached the stage wherein even stage 4 we can cure the patient.
ഓക്കെ ഓക്കെ സാർ. സി ഈ ഡിസ്കഷൻ്റെ ഇടയിൽ സാറ് പറഞ്ഞു ഇപ്പം സ്റ്റൊമക്ക് ക്യാൻസർ, സ്റ്റൊമക്ക് റിമൂവ് ചെയ്യുന്ന ഒരു ഓർഗൻ, ചില ഓർഗൻസ് ഒക്കെ റിമൂവ് ചെയ്യുന്നത്. സി അങ്ങനെ വളരെ വൈറ്റിൽപ്പെട്ട ചില ഓർഗൻസ് റിമൂവ് ചെയ്ത് കഴിഞ്ഞാൽ സി പേഷ്യൻറ്റ് ഹൗ ഹി ലീവ് സർ?
Okay. So the treatment of or a surgery of stomach cancer or the stomach is called as gastrectomy.
Yeah.
Okay.
Yeah, that's the one word is there.
Yeah,
Yes, correct.
gastrectomy.
Medical term.
Okay. So in gastrectomy there are different types of gastrectomy.
Yeah.
Okay. If we remove whole of the stomach,
Yeah.
it is called as total gastrectomy. I remove total gastrectomy.
Okay, so here is one more doubt. Sir. See, total. Then why should they are taking food? Then where it reached? So maybe you have some doubts.
Yeah, I'll tell you. This total gastrectomy.
Okay.
There's something called a subtotal gastrectomy. We retain some part of the stomach. Then next is distal gastrectomy. Okay. Distal means the last part of the stomach we remove, right?
Okay.
So 3 types of cancer surgeries for stomach are there.
Yes.
So if I do distal gastrectomy, I have major portion of the stomach remaining.
Okay.
To that I will join the small intestine.
Yes. Yeah.
Small intestine, that is, So that small intestine, we take it and join it to the remaining part of the stomach. Right. For subtotal gastrectomy means what? We are removing major 90% of the stomach is removed.
Yes.
Only 10% of stomach is remaining near the food pipe, upper part.
Okay.
There we take same small intestine we take and we join it there. Okay.
Okay.
So that is easy.
Okay.
But sometimes the patient will having the stomach cancer in the whole of the stomach. There we remove total gastrectomy. Total stomach is removed.
Okay.
Total gastrectomy we do. In that what we do, we try to mobilize the food pipe. Food pipe we try to mobilize and we'll try to take it in the abdomen area. Then we to the food pipe or the esophagus that we say in medical term, we join the small intestine to esophagus.
Okay.
So after total gastrectomy or subtotal gastrectomy, patient will not have that sensation of filling of stomach.
Yes.
They will not have sensation because the stomach is not there.
Okay.
But still patient can have normal food.
Okay.
But for those people, what we say, you ask me how patient is going to live.
Yeah.
Yes. Patient, we have some advice to the patient. We tell them to have little quantity of food for increased number of times.
Okay.
Now we are having, for normal individual, we will have 3 times a day. Right? For example, 3 times a day we can have 1 kg of biryani. Right?
Okay.
3 times.
Okay.
1 kg, 1 kg, 1 kg.
Okay.
But if patient has underwent total gastrectomy, we tell to them, have only 100 gram of biryani.
Okay.
Right? 100 gram of biryani for 6 to 7 times a day.
Okay.
100 to 200
times it will increase.
Yeah. Then the total it will increase.
Okay.
Then we ask them to have good amount of liquids.
Okay.
Good amount of semi-solid diet. So those things will give advice to the patient to. Anyhow, they have to change their habits, lifestyle. They have to change. Accordingly, they can survive.
Okay.
It is not a big issue.
Okay. See, sir, another one doubt is this one, sir. See, whether the cancer is spread to, see, when touching or other, is it spread?
Touching the cancer patient, will it spread? Will we get that disease? No, not like that. As I told, even if a skin cancer is there, skin cancer, even if you touch a patient with skin cancer, so it will not spread. Stomach cancer is inside the body. Skin cancer is outside over the body.
Even though, okay.
Yeah, so it won't cause, it won't spread. There is a number one myth.
Okay.
Another thing is like even if I eat spicy food, it might increase the acidity. Will it cause stomach cancer?
Okay.
So even that is a myth also.
Okay.
So spicy food, ingesting spicy food doesn't cause stomach cancer, but if we keep on repeating the same spicy food every day, every 2 to 3 times a day for a longer period of time, yes, it can cause. Not directly, but indirectly.
There's a chance of getting.
But taking a spicy food once in a week doesn't cause stomach cancer.
Yes, sir. Correct.
Right. So then other myths like few patient comes and talks to me, sir, by doing surgery, I think it is going to spread. No, it is not going to spread. Surgery is one option where we are going to remove the tumor.
Okay.
And some people ask, sir, if I do laparoscopy, keyhole surgery, if I do keyhole surgery, then doctor might leave some amount of tumor inside the body and it come out.
Okay.
You better do open surgery. Now the advancement is so much. By doing a keyhole surgery, we are able to see each and every corner of the abdomen. Right?
Okay.
We can go and see. We can put some dyes in the body.
Clear picture.
Yeah. We can put dye also.
Yeah.
To see where the tumor is spread. So that is the advancement technology that we are seeing today. So that we can trace the tumor by doing this laparoscopy or robotic surgery that I do here.
Okay.
So we can completely remove the tumor from the body.
Okay.
So these are a few myths.
Okay. So see, sir, നമ്മൾ ഏത് ഡിസീസിനും നമ്മൾ പ്രിവെൻഷൻ ഈസ് ബെറ്റർ ദാൻ ക്യൂർ എന്നൊക്കെ പറയുന്നത്. ക്യാൻസറിന്
Cancer prevention is always possible.
Yeah.
We can prevent cancer. How?
Yeah, that's
by
a very difficult question.
having a healthy lifestyle.
Yeah.
Practical things I'll tell you.
Hmm.
Simple thing is have a good amount of vegetables and fruits in the diet. Have non-veg food also, but to a limitation.
Okay.
Try to avoid red meats,
Okay.
which is from goat, beef, lamb.
Okay.
Those meats you can have, but maybe once or twice in a month,
Okay.
not daily basis,
Yes.
not 2 to 3 times in a week.
Okay.
Try to increase white meat. We are lucky we have fish.
Okay.
It is a white meat. Consume fish as much as possible, but not smoked fish, not preserved fish, not the salted fish, not the grilled fish, right?
Okay.
So those things try to
We should
avoid.
explore.
Tawa
Okay.
fry, try to avoid.
Okay.
You can have masala fry, the steamed and all, but masala and tawa fry
Better.
not so frequently, once or twice in a month.
Okay.
So this is with respect to food. Try to avoid smoking. Most common cause for all the cancers. Try to avoid alcohol. Alcohol in limit, but not on daily basis.
Okay.
Right?
Okay.
Smoking, zero.
Okay.
So alcohol, limited. Then healthy habits like daily exercise. At least have some exercise for 30 minutes in a day.
Okay.
That is more important.
Okay.
Try to flex your muscles. Muscles should feel that, okay, I have worked out for some time. Better is to walk every day.
Okay.
So these are the few things in your life.
Okay.
Another thing is try to take less amount of stress in your life.
Okay.
Stress is also a major cause for cancer. It has been proven by social experiments.
Okay.
Even I have proven, like even I did a study way back in 2016 and 17. So the stress is a major factor for ovarian and breast cancer.
Okay.
This study I did it in Ahmedabad. So try to avoid stress in your life.
Relax our
Life
mind.
is short.
Yeah, mind.
Try to enjoy it.
Okay.
Don't stress it, and don't try to get cancer.
Okay.
So these are the few simple practical health tips
for, yeah.
to avoid cancer in your life.
Okay. So one more, yeah. Yes. So one more thing is that see, even it is we have seen that advertisement is there. Okay. See, social media is. നമുക്കിപ്പോൾ കാണാൻ പറ്റും സോഷ്യൽ മീഡിയയിൽ വളരെ ഇതായിട്ട് ഈവൻ ഫോർത്ത് സ്റ്റേജ് ക്യാൻസർ ഓൾസോ വിത്തൗട്ട് എനി സർജറി വിത്തൗട്ട് എനി അതർ മെഡിസിൻ വി ക്യാൻ ക്യൂർ ദിസ് മച്ച് സോ മെനി എക്സാമ്പിൾ ദേ ആർ സീയിങ് യു മേ ഹേർഡ് ദാറ്റ് ഓൾസോ സീ വാട്ട് ഈസ് അഡ്വൈസ് ടു അവർ വ്യൂവേഴ്സ്
So I tell to them it is left to the viewers itself.
Yeah.
So viewers or the general population, general people, they have to think what is right, what is wrong.
Yeah.
So what I can say is I can tell about my field, right?
Yeah.
I can't tell about other.
Okay. We don't want to blame. Yeah. Correct.
I don't want to blame also. I don't want to give any comment on those people.
Yes.
But the thing is, yes, our technology or our medicine is
It's already proven that.
evidence-based medicine.
Yeah.
We take the treatment, we try it on the patient only after it get enough evidence
Okay.
in the research.
Okay.
Research, it starts from the molecules in the laboratory, then it comes to the biological laboratory wherein we test on the animals, then it comes to trials in the general population, then it get activated in the nodded from the many bodies.
Okay.
It's like that.
Okay.
So for few patients for stage 4 cancers, Ayurveda give good results
Okay.
with lesser side effects from the chemotherapy. They can try it because even the Ayurveda medicines, they have the compounds or the molecules which are there in our older chemotherapeutic drugs.
Okay.
Old chemotherapeutic drugs were there in 1970s, 80s. Those drugs, the compound that we had, so they are there naturally in the Ayurveda products.
Okay.
So for stage 4, yes, if they can't afford, if they have more side effects and all from the modern technology, they can go for it. But still, only after meeting a cancer specialist, whether it is medical oncologist or surgical oncologist or radiation oncologist, after meeting them, after discussing with them, then you can take a chance of going to other alternative type of medicines.
Okay, sir. മെഡിട്രാക്കിൻ്റെ ഇന്നത്തെ എപ്പിസോഡ് ഇവിടെ വൈൻഡപ്പ് ചെയ്യുകയാണ്. ഈ എപ്പിസോഡിൽ കാസർഗോഡ് വിഷൻ്റെ പ്രേക്ഷകരോട് സംസാരിച്ച മാംഗ്ലൂർ AJ ഹോസ്പിറ്റലിൽ സർജിക്കൽ ഓങ്കോളജിസ്റ്റ് ഡോക്ടർ അജയകുമാർ സാറിന് കാസർഗോഡ് വിഷൻ്റെ നന്ദി അറിയിക്കുന്നു. ഒപ്പം എല്ലാ പ്രേക്ഷകർക്കും നന്ദി, നമസ്കാരം. താങ്ക് യു, സർ.
Thank you very much.